Hi everyone, this is Dr. Sri Devi. I am a gynecologist and today we are going to discuss about menstrual hygiene, which is a very important topic for all the teenage girls. And so I have a guest today with me, and guess what? She's my daughter, Shriya of 12th standard, and she is going to shoot me the questions which I am going to answer today. Shriya, are you ready to ask me questions? Okay, so you go ahead now.
What is menstrual hygiene at first?
Okay, so to know about menstrual hygiene, first thing that you have to know is you should know what is menstruation. Okay, so let me teach you some basics of menstruation. So this is the shape of your uterus. This is how the uterus looks like, and you have two tubes on either side. So this is one fallopian tube and this is another fallopian tube. You have one ovary here and other ovary here. So when the girls are born, they are born with eggs inside the ovary. So these eggs, they will be immature till the age of 11 or 12 till they achieve their menarche. So once they attain their puberty or menarche, what happens? Each month there will be one egg which will mature, and this egg will be picked up by the fallopian tube, and when this egg reaches the fallopian tube, if it is not fertilized by the sperm, this egg will reach the inside of the uterus, which is called the endometrium, and this along with the endometrium will shed every 28 days. So this is called as menstruation. So it's very important to maintain your hygiene during menstruation, because if you don't maintain hygiene during your menstruation, you can get a lot of infections like urinary tract infections and also sexually transmitted infections, and these infections can later on lead on to problems like infertility and lot more problems. So you should be very much aware of how to maintain your menstrual hygiene. So keeping yourself clean and tidy during menstruation is nothing but menstrual hygiene.
So my next question is that how should one take care of themselves during their periods?
Okay, so during periods, how should you take care of yourself? The first thing is you have to use some absorbable material to absorb the blood which is coming out of your uterus. So you can use either sanitary pads or you can use clean cotton pads. Whatever is available you can use. You can also use menstrual cups, which are becoming very famous nowadays, or even tampons. So whatever material, menstrual material you use, one thing that you should be very careful about is change your pad every 4 to 6 hours. If you keep using the same pad for a long time, there are chances that fungal infections can occur, and this is not good for your body. So you have to change your pad at least 4 to 6 hours once, even if it is not fully soaked. If you are using a menstrual cup, maybe you can take the cup, clean it and reinsert it after 8 to 12 hours. That's fine. But when you use a menstrual material like a cotton cloth or a sanitary pad, it is mandatory that you change every 4 to 6 hours. And clean yourself every 4 to 6 hours with clean water that is sufficient. There is no need to use any special vaginal washes, and avoid soaps which are scented, because many people think that some odor that comes in the vagina is very disgusting and they start using scented products, which is not the right thing to do, because you have got some good bacteria in the vagina. See, this is the vagina. Here you have got some good bacteria. This good bacteria maintains the acidity of the vagina. The pH of the vagina is acidic. This is maintained by the good bacteria which is present in the vagina. If you use lot of scented products or harsh soaps, this bacteria can get washed away. So because of that, what happens? You will be more prone for infections. So that is why you should not use any harsh soaps in your vagina. You can use mild soaps or just plain water, that is enough. And the other thing is, during your menstruation, you should also take a lot of water, because you might feel dehydrated. So you should take a lot of water. This is how you can simply take care of your periods.
Yeah, and what are menstrual cups?
Menstrual cups are nothing but these are small eco-friendly cups, because here it is made up of silicone material, because most of the sanitary pads which we use are not degradable. It takes around 500 to 600 years for one sanitary pad which is made of plastic to degrade. So it is not good for the Mother Earth, right?
Yeah.
So instead of that, you can use silicone cups. These silicone cups can be reused. It can be used for almost 4 to 5 years. You can use the same cup. You have to just wash and keep reusing it. And it can be used by anybody as young as 18 years to as old as 50 years.
Now, why there is pain during periods?
See, many children, many adolescents like you, they have cramps during their menstrual periods. So this is because there is something called prostaglandins which is released along with the period. So along with the blood there is some substance called prostaglandins which is also released. So that is what causes pain. Usually this pain gets settled as age progresses. Probably after the age of 18 or 19 the pain might reduce. And even after having childbirth, the pain might reduce even more because the lower part of the uterus, right, the cervix, this will get little bit dilated. So it is easy for the blood to come out. So the cramps will also reduce as age progresses. But in case if you or any of your friends are suffering from severe cramps that you're not able to go to school or do your daily activities, then you have to definitely meet a doctor to find if there is any other problem. Because there is a condition called endometriosis which also has difficult pain during periods which is called as dysmenorrhea, and it is generally overlooked by the girls as well as by their parents. But when they come late to the doctor, it will be too late to treat the condition. So it is always better if the cramps are very debilitating, if the girl is not able to go to school, then it's better to consult a doctor and get a scan done.
So the next question is like one of the most common doubts among my peers circle as well. So can we do exercise? Like can we do workout during periods?
See, if you are an active girl, you can continue doing your workout during your periods, but make sure it is not a very high intensity workout. You can do moderate workout during periods, maybe some yoga you can do, some moderate workout you can do, and make sure that you don't get dehydrated, because doing exercise during periods actually helps in reducing the menstrual cramps which causes pain. So you can continue doing exercise but in a moderate intensity. That will help you in easing the pain also.
So what is the proper diet that has to be followed during this time?
Okay, so this is a very important question because I know that girls start craving for junk food during periods, right?
So how to stop this craving at first?
So first of all, you have to know that craving for certain food is because of the hormonal changes that happen during periods, but it is always a good thing to have good, healthy, balanced diet during periods. So you drink a lot of water, take potassium rich foods. For example, you can take tender coconut water, and also you can take spinach or red meat which is good in iron. This is because you will be losing a lot of blood, right? You will be almost losing 80 ml to 90 ml during every periods. So you will feel a bit fatigued and tired. So you take a lot of food which contains iron like spinach and red meat. This will help. But most of the girls, what do? They start munching on a packet of potato chips, which should be avoided, because already your body will be a little bit bloated and there will be some kind of salt retention during your periods. So if you start munching on all kinds of salty and fried food, it will only worsen the problem.
Okay, now, when should a girl or woman meet a doctor? Which is the right time to do that?
Okay, so as far as menstruation is concerned, if a girl is 15 years old and she has not attained her periods yet, then she has to definitely meet a doctor. And also the other thing is, if she is getting periods more frequently, like once every 21 days, or if she is getting periods after 45 days, like if the periods regularity is not there and she gets her periods only after 45 days, also she has to meet a doctor. And if she is not getting periods for a period of 3 months, or she is bleeding heavily for 8 days or 9 days and she has to change the pad every 1-2 hours, or if she is passing clots, then she has to definitely meet a doctor, because this can be a sign of some hormonal problems. Because nowadays we see lot of girls are suffering from a condition called as PCOS, which is polycystic ovarian syndrome. Here what happens, the ovulation doesn't happen every month. Because the ovulation doesn't happen every month, she will not be getting her periods every month. So instead, they will be delayed for a period of 2 months or 3 months, and once they bleed, they will be bleeding like for 15-16 days. So this is very bad for the health of the girl, so she has to definitely meet a doctor. And also if she is getting some abnormal hair growth, some amount of hair growth in the face and all is normal. But if she is getting abnormal hair growth, or there is sudden gain in weight, or if she is getting some silky kind of patterns in the neck which is called as acanthosis, here the skin will be very thick, and these are all indications of hormonal problems. So if she is having anything like that, then she has to definitely meet a doctor. Okay, hope this video was useful to all the viewers. So we both will meet you again in another interesting topic on teen health. Thank you, and this is Dr. Sridevi signing off.
And this is Shriya signing off. Bye.
Thank you.